Classification of articulators. The classification based on instrumentation function, based on theories of occlusion, based on type of interocclusal record used, and based on the adjustability. So various classifications are there. First, based on instrument function. So by the ability of the instrument to simulate the jaw movement, the classification was followed. In the International Prosthodontic Workshop, at the University of Michigan in the year 1972, this classification was came into existence, and this was based on instrument capability, intent, recording procedure, and record acceptance. There are four different classes are there under this classification. So first is class 1, which is of hinge type. It is a simple articulator. They are going to just hold the cast in the upper and lower compartment. So they have only vertical motion. The positive stops and locks at the mounted position are available. They are used in cases where the tentative jaw lesion is done. So for crown and bridge cases and operative instrument, it can be used. The examples are slab articulator, Geisy simplex, Brandour articulator. Second was the class 2, which is of arbitrary type. So this articulator will permit horizontal and vertical movement, but they do not orient the movement to temporomandibular joint with the face bow. So under the class 2, three subdivisions are there. One is type A. So this will accept the eccentric motion in unrelated to the patient motion, and they will permit the limited eccentric motion based on average values. The condyles are on the lower member of the articulator. So here this type A is based on the Bone-Mills triangle. Examples are mean value articulator and Geisy articulator. Under class 2, the type B, that will permit limited eccentric motion based on arbitrary theory of motion and also the spherical theory of occlusion. Examples are Monsoon articulator, Hall's articulator, and type C, class 2 type C, which permit limited eccentric motion based on the engraved records which is obtained from the patient. The examples are House articulator and Matic relator. Class 3, it is an average articulator. They permit horizontal and vertical motion. They will accept the Facebook transfer, but these facilities very much limited. They do not allow total customization of the condylar pathway. And also, they simulate condylar pathway by using average or mechanical equivalence for the whole or part of the condylar motion. They allow joint orientation of the cast and maybe archon or non-archon instrument. They also fulfill the requirement for complete denture construction. They have a very good centric log, progressive and immediate side shift controls are present. Protrusive inclination and also inter-center distance adjustment is also possible. A simple mounting procedure, a good study design and the archon arrangement is made possible with this articulator. All examples are archon instruments. They accept the face bow and have mounting plates for unlimited case load. Under this class 3, the first subtype is type A. They will accept the static protrusive interocclusal record and also they will accept the Facebook transfer. They will use equivalence for other type of motions. Example, Hana H articulator, Hana H2 dentatus articulator. And the subgroup of class 3 is type B. They will accept the static lateral protrusive interocclusal record and also they have the capability to accept the Facebook transfer. They use equivalence for other type of motion. The various examples are true bite articulator, Ney articulator, Panadent articulator, Denmark articulator, Whipmix articulator, and Tripod articulator. The fourth type is a class 4, which is a special articulators. They will accept all three-dimensional dynamic registration, capable of accurately reproducing the condylar pathway for each patient. They allow joint orientation of the cast using Facebook transfer. Also allow for orientation of the cast to the temporomandibular joint and replication of all mandibular movements. The instruments of choice for complete reconstructions. So this instrument, they will hold the adjustments, contains good centric locking mechanism, versatile incisal guide tables, and stable mounting features, and be precision engined. Under this class 4, the type A, they will accept three-dimensional dynamic registration and also help, they have the capability to accept the Facebook transfer. The condylar paths are formed by registration engraved by the patient and the path is non-modifiable. Example, TMJ articulator and stereograph. Then the type B, they will accept three-dimensional dynamic registration. They utilize the phaseboard transfer. Here, the condylar pathway that can be selectively angled and customized. So this will utilize the phantographic tracing. Example, nathoscope, pantonic articulator, simulator, and Dinar model SC and Dinar D4A. Then moving on to the based on theories, how the articulators are classified. First, they are classified under Bonville theory articulator. So this was given by Bonville in the year 1858. He was the father of anatomic and balanced occlusion. He was the one who gave the theory of equilateral triangle. So this type of articulators will allow lateral movement and permit movement in horizontal plane. Second articulator based on theory is the conical theory articulator. It was given by R.E. Hall in the year 1918. So this adjustable 3D anatomic articulator, they will provide universal mandibular movements. They have an adjustable incisal guide and the lower teeth can move over the surface of the upper teeth as over the surface of a cone which is generating an angle of 45 degrees. That's why it is called conical theory articulator. So next is the spherical theory articulator. It was given by G.S. Monsoon in the year 1916 and based on spherical theory of occlusion. So the lower teeth move over the surface of the upper teeth as over a surface of sphere, the diameter of 8 inches with its center located in the region of glabella. So now, based on the interocclusal record, one which is the eccentric pathways can be dynamically registered either graphically, that is by pantographic method, stereographically by engraving method, by positional registration by using the check bite method, and by using the articulator that is mechanical equivalence and adjusted entirely on the patient. So now, based on the adjustability, it was given by Rayani in the three types. One which is non-adjustable, second is semi-adjustable, then is the fully adjustable. So non-adjustable means no such movements are made possible with your compartments. Semi-adjustable, the HANA articulator, the dentatus article will come under this. So these articulators will possess some amount of movement possible, similar to the patient. So here the archon means the AR represents the condyle, articulator, CON represents the condyle. So archon means the condyle is located in the mandibular compartment, as you can see in the person or in the um, patient's mouth. Similarly, the condylar element will be seen in the mandibular compartment, whereas non-archon is the condylar element will be seen in the upper compartment, and the foci for the condylar element will be seen in the lower compartment. So fully adjustable articulator means the entire adjustments are made possible using this articulator. Thank you.